Aloha, everybody, and welcome to our brown bag lunch here at Mental Health America of Hawaii to kick off Children's Mental Health Week. We're so happy today to have Dr. Amber Kawamura as one of our board members here, our advisory board members on Maui. She's going to present Keiki mental health disorders, how to get help, and how to cope. We will be recording this and posting it onto our YouTube page, and then we'll also send everybody a PDF of the training as well when you're done with this today, and we'll also send our most recent resources as well. So Dr. Amber Kawamura is board certified in Child and Adolescent Psychiatry, as well as Adult Psychiatry. She's been in practice for over a decade in Central Maui and sees patients of all ages in various mental health conditions. She is passionate about mental health advocacy and reducing stigma, and is also a local girl who grew up here on Maui, and she loves to be able to give back to her community. And without any further ado, I am going to turn it over to you, Dr. Kawamura. Thank you.
All right, well, thank you so much, Danielle. I'm really pleased to be here with everybody. Thank you for joining us. I'm really excited that it's May again. It's Mental Health Awareness Month, and especially for our Keiki, we're celebrating them this week and really being mindful of their mental health and wellness. So thank you all for coming. I'm really glad that you could all be with us today. I'm going to go ahead and share my screen. Give me a minute here. All right, is that looking okay? Yep, okay, all right. So yeah, so I'm happy to present today about Keiki mental health disorders, how to get help and how to cope. And I would love it if this was kind of, informal. If people want to ask questions, feel free to type it in the chat. Don't feel bad about interrupting. I want to make sure that, people get their questions answered, or, that this can kind of just be a good discussion, and I want to make sure it's helpful to all of you. So again, yay, Mental Health Awareness Month. This is our chance to really be mindful of the fact that this important organ here is really special, and it's something that we really want to take great care of. And we want to be aware that, if this isn't going well, the whole rest of this isn't going to go well. So we really got to take care of our brain and our mental health. So again, happy Mental Health Awareness Month and happy Keiki Mental Health Awareness Week. And mahalo nui loa to Mental Health America and to Danielle for bringing this out to you. All right, so I'm gonna kind of jump right in. So what can kids be diagnosed with? And I'm gonna apologize in advance that this is a very busy slide. So the point of having this up there is, again, for us to kind of keep in mind that this is a pretty complicated organ, and when it gets sick, it can get sick in a lot of different ways. So the Diagnostic and Statistical Manual, that's the book that we all use to help diagnose mental health conditions. And it lists out different criteria for different diagnoses. And what I figured we could do is talk a little bit about some of these, and certainly at the end, if people have questions, they want to dive in a little bit more about any of these, I'm more than happy to answer questions. So we'll just talk a little bit in general. So you'll see at the top there, anxiety disorders, super common in kids, oftentimes missed. A lot of times kids don't have the right vocabulary to express themselves, like they might know that, gosh, my tummy hurts, or I feel kind of shaky, or I don't feel right. But they might not yet have the language or the know-how to explain that, gosh, I'm feeling anxious, I am worried about this or that. So anxiety disorders can often be missed in kids, or kids can present as seeming irritable or upset or having tantrums or meltdowns. And sometimes what's underneath is anxiety. So there's different things like separation anxiety, where kids are really scared of being separated from an important attachment figure. There's selective mutism, phobias, fear of heights, fear of blood draws. There's things like generalized anxiety disorder. Anxiety is like the Baskin-Robbins. There's so many flavors, right? So anxiety can come in many different forms. With generalized anxiety disorder, it can look a lot like ADHD, because kids are nervous and worried, and they can have focus very well, and they're fidgety, but comes from a totally different place. So that's why it can be really helpful to get a good diagnosis so you know what's going on and you can give the right treatment. There's also things like social anxiety disorder, panic disorder. And the next part, it mentions about neurodevelopmental disorders. So these are conditions that kids are born with, right? Their brain is just kind of formed that way, and they're going to have these difficulties unless they get help to kind of learn how to cope and how to manage. So there's things like ADHD, attention deficit hyperactivity disorder. There's also learning disorders, things like specific learning disorder in math or specific learning disorder in reading or written expression, things like dyslexia. There's also autism spectrum disorder and other things like intellectual disability and communication and other motor disorders that would fall under that category. There's also disruptive disorders, things like oppositional defiant disorder. Sometimes we're not quite sure, what's going on yet, but we see these oppositional behaviors. A kid who's angry, who is defiant, they don't want to listen to the rules. They're pushing against authority figures. And sometimes it takes a while, but sometimes we find out what else is underneath and we can help to correct those behaviors or help to change the environment to help that kid be able to express themselves better. There's other things like conduct disorder, intermittent explosive disorder that also kind of go in that category of disruptive disorders. There's also mood disorders. That's another way in which the brain can get ill. Things like major depressive disorder. That's something that I'm sad to say I have seen grade schoolers with it, but not often, thankfully. This is something we more commonly see in teens or adults, but teens can definitely get episodes of depression where they're not enjoying life as much. Maybe they find it hard to feel happy. They might seem grouchy or irritable. They might not feel so great. And it often messes up other things too, like their sleeping, their eating, their ability to pay attention. Oftentimes with an episode of depression, we see people's grades go down. They can have thoughts that are more negative, hopeless, feel like they're no good, nobody likes them, all the way to the point of maybe having thoughts that they would be better off dead. So these are important things for us to know about so that we can ask our kids, if we're seeing them stay in the room more and they're not coming out or they're not eating as much, we want to be able to know about these things in order to ask, because the only way to know what's going on is to ask so that we can help. There's other things in mood disorders like bipolar disorder and disruptive mood dysregulation disorder. We don't commonly see bipolar disorder as much in kids, but it can be there sometimes, especially if there's a strong family history. And that is something that's helpful to know, is that a lot of these mental health conditions run in families. So if you know this stuff is in your family, that might be like, oof, note to self, I gotta pay more attention and watch for this in my kids. That way you can help them early on. Disruptive mood dysregulation, I'll talk a little bit about that because people might not have heard of that as much. That is a relatively new diagnosis that came out in the DSM-5 or Diagnostic and Statistical Manual number 5. So that blue book there, we're on the text revised version of it, but it's still relatively new. Before that, we didn't have DMDD. So that was meant to, I think, kind of capture. At one point, there was a lot of overdiagnosis of bipolar disorder in some kids who had a lot of irritability and moodiness. And it turned out that those kids didn't actually develop into people with bipolar disorder like what we would normally see. So there was a new category made, disruptive mood dysregulation disorder, that kind of goes more under the umbrella of depressive disorders. But that's meant to capture those kids that don't fit classic depression. They don't fit classic bipolar disorder symptoms, that they're having, severe moodiness, temper outbursts. And if people have more questions about that later, feel free to ask. But that is kind of a relatively new one that people may not have heard as much about. I'm sad to say that there's also still a lot of trauma out there in this world. So disorders related to trauma are things that we still do see commonly. Things like post-traumatic stress disorder can definitely happen in kids. Sometimes the way it manifests is a bit different, right? We might see kids acting out their trauma through play. They might not say it as easily as adults might, but it is something for us to keep an eye out. If kids have gone through some kind of trauma, whether it's a car crash or trauma between individuals, it is something important for us to screen for and to be able to treat. There are some other trauma-related disorders like reactive attachment disorder and disinhibited social engagement disorder. They're not as commonly seen though as PTSD, but those are out there too. Let's see, addiction, that's definitely an important issue for us to watch for. A lot of people have addiction in their family. So again, it's one of those things, okay, if there's a lot of people in the family that struggle with that, I got to make sure to watch for that in my kids and make sure they have the right education and supports to try to beat that genetic loading for that, or to be able to have the supports to get through it if they themselves end up struggling with an addiction. And that is something we commonly do see in our mental health practice with teenagers. Maybe not as common, but still important is the next category, eating disorders. So things like anorexia. Anorexia is one of our most deadly psychiatric disorders. So even though it's not super common, it is very important for us to identify and to treat. And it gets a little confusing sometimes diagnosis wise between anorexia and bulimia. People often think like, oh, there's anorexia and then there's bulimia, where people may binge and purge, and actually both conditions can have that. It's just that in anorexia, people are severely underweight, whereas in bulimia, people can be their normal weight or even sometimes a bit overweight. But these are important things to watch for, especially in our teenagers, and because they would require very intensive treatment. There's also binge eating disorder and another kind of new one, ARFID. I don't know if any of you have ever heard of that, but avoidant restricted food intake disorder. That's another one that came along with the DSM-5. And then there's other less common things like pica and rumination. Psychotic illness, that's kind of where the brain can be out of touch with reality, where people may be hallucinating, they may be seeing things that aren't really there, they may be hearing things that aren't really there, they may be paranoid and having false beliefs, but their brain is telling them it's 100% true. And things in that category would be schizophrenia or schizoaffective disorder. These are conditions that we don't see nearly as often, but they are very important to diagnose early and to get treatment early. And I'm happy to say that the Maui Family Guidance Center, our Family Guidance Center systems in Hawaii, do have some early intervention programs now for people who are struggling with psychotic illness. So that's really wonderful that our community has that now. Let's see, just to explain a little bit, so the psychotic stuff that we touched on earlier, that goes with schizophrenia. If you've not heard of schizoaffective disorder, it's kind of a combination between schizophrenia and bipolar disorder, where people can have those feelings of the brain being out of touch with reality, but also have mood swings where they have episodes of depression, but also episodes of mania where people are feeling the opposite of depressed, right? They might have tons of energy and be really talkative and they feel like they don't need sleep. Those are some of the hallmark signs of mania, which is the upside of bipolar illness. Let's see. After that, there's kind of the obsessive compulsive and related disorders. So OCD is obsessive compulsive disorder, where people can have obsessions that are unwanted thoughts, ideas, or images that keep coming in their mind. For example, that could be unwanted thoughts that a person's going to get sick. And then they might have certain compulsions, which are behaviors that they do to kind of manage those obsessions, right? So if I had an obsession, a worrisome obsessional thought that I was going to get terribly ill, I might have a compulsion to wash my hands a whole bunch, and I might have to do it in this certain regimented way. And boy, if my mom interrupts me, I might have to do it all over again. And then you can see how that would take a really long time to do it all over again. So OCD usually takes up a lot of time. And that's how parents sometimes catch it in their kids. It's like, okay, we need to leave like 15 minutes ago. Why are we still taking forever in the bathroom? So yeah, but OCD can be kind of a sneaky one because the obsessions and compulsions aren't always related to germs. Sometimes it can be symmetry, like something taps this side, you gotta tap that side, or having things just so, or organizing it a certain way. And it can be very, very upsetting for a kiddo who's struggling with something like OCD if those obsessions and compulsions get interrupted. without them having the right help to deal with that. And it can be very frustrating for parents, of course, if they're not sure how to help and they're just trying to get the kids to stop. So that's where having help is an awesome thing. And I want to say that asking for help is always a sign of strength, not a sign of weakness. It's terrific when people can ask for help. Let's see, also under that category of obsessive and compulsive related disorders are things like excoriation disorders. So some people who might scratch or pick excessively, or trichotillomania, that's the hair pulling one, or hoarding, that also kind of goes under that umbrella of conditions. There's also elimination and sleep disorders. So these are things that we might see more in kids and not so much in adults, but things like encopresis and enuresis. So bedwetting or having trouble with number 2 happening when it's not supposed to. So this is usually in kids who have either, they've gone through potty training, but then something happens and they regress, or maybe they're at a certain age where toilet training really should have been accomplished already, but it hasn't. Then people may meet criteria for conditions like encopresis or enuresis. Night terrors is a little weird. It's actually a condition that happens in the deep stages of sleep. It's, your kid might be, freaking out and having this horrible dream and it sounds horrible. And you might be tempted to wake your kiddo up, but really the best is to just get them back to bed because they're in such a deep stage of sleep, they're not going to remember it unless you wake them up and they're then, feeling freaked out because they don't know where they are or what's happening. There's also somnambulism. That one just sounds cool. It's sleepwalking, but it just sounds so cool, right? Somnambulism. So I had to throw that one in there. And then there's gender incongruence. So we want to support our gender diverse youth. There's a lot of issues with higher rates of suicide and bullying and a lot of difficulty that our youth go through. And so we want to make sure that we're identifying issues in that category and providing supports and help. All right, so I know that was a lot, and I don't know if there's anything in the chat, if there are things where it would be a good time to interrupt with any of that. No, okay. All right, so you might think, holy moly, she went over so much. How am I ever going to remember any of that? I said, don't worry, there's no quiz at the end. You don't have to remember this. But if you want some more information, check out acap.org. So aacap.org, the American Academy of Child and Adolescent Psychiatry. They have a really great website. So I don't know, can you see my cursor? Can you see the arrow going around there? Yeah. So if you go to families and youth, and I'll show you on the next page, it's a little busy, but I'll show you what it looks like. You click on families and youth and you go to facts for families. And then you'll see this facts for families guide where it's got all kinds of stuff, right? From A to W, not all the way to Z, but A through W. And you'll see they've got ADHD in the brain, adolescent development part 1, adolescent development part 2, adopted children. Yeah, if we skip over to C, caffeine in children, child abuse, the hidden bruises, child and adolescent psychiatrist, children in divorce. They've got all kinds of topics, right? So if there's something that you want to learn a little bit more about, you could definitely head over to their website and check it out. So again, acap.org, and then you go to Facts for Families. And just to give you an idea of what these sort of look like, they're usually fairly short, like 1 to 2 pagers. So this is just the one on anxiety in children, and it kind of gives you a snippet about, what kids who are struggling with anxiety might feel like, what some of the symptoms might be like, a little bit about some different conditions. So it's kind of a short and sweet, just give you kind of an idea of what's going on. This is sometimes helpful if kids get diagnosed with something and parents want to share a little something with teachers or other family members and they're not sure how to explain it all. Sometimes these Facts for Families handouts can be really helpful for that. All right, so let's say you've watched this today and you're like, boy, there's some stuff that runs in my family and gosh, I don't know, it's like some of that stuff kind of sounded like stuff that my kiddo might be struggling with. Like, how do I get help? Well, you're in luck because that's the next part of our talk today. So there are a lot of different ways that somebody can get help. Most people will go through their health insurance, right? Stop at the doctor's office. Hey, I need help. What's going on? Let's figure this out. Schools can also help with getting kids assessed and treated. There's Hazel now. Some of the schools can refer to Hazel for therapy for kids. I don't know a ton about it. I think it's somewhat time limited. So still always helpful to go through your health insurance to get diagnosed and treated. But there are supports all around for our Keiki. There's also, as we talked about a little bit before, there's the Child and Adolescent Mental Health Division. We are lucky to have the Maui Family Guidance Center and its satellite offices as part of the Child and Adolescent Mental Health Division. And they can also help particularly for Keiki who are on Quest or who have an IEP, which is an individualized educational plan. And that's something that they would get through their school. So kids who have either of those can get help through the family guidance centers. And you might be thinking like, okay, so I go through this, my health insurance or whatnot, like who's going to be actually seeing my kid or treating my kid? A lot of times the pediatrician might be the first stop. So it might be like, hey, my kiddo is kind of struggling in school and they're maybe having some behavioral problems and their grades are not so great and they're not paying great attention. Your pediatrician oftentimes is someone that you guys have a good relationship with already. So sometimes people will start there with checking in with the pediatrician and seeing what they think. There are some pediatricians who are really great at mental health stuff, and there are some that don't have as much experience. So a lot of times a good pediatrician who's not sure what's going on will refer to a mental health provider. And that might be someone like a psychiatrist, a psychologist, maybe a licensed clinical social worker, maybe a licensed marriage and family therapist, or others, right? So at the schools, there's things like school-based behavioral health specialists. There's also school psychologists. So there's a bunch of different people out there who want to help and they want to share their knowledge and be able to help get your Keiki off on the right foot. Now you might be thinking, okay, like, my girlfriend said that they were, trying to get their kid in, and boy, it was a long wait. And unfortunately, we don't have enough mental health providers. We live in a rural area. I wish there were like 10 times as many of us, but there's not. So a lot of times when people are calling, they may get, hey, we'd love to help your kid, but we've got an appointment in like 3 weeks from now, or a month, or 2 months from now. So you might be thinking, well, what if it's an emergency? What do I do if I need help like right now? If it's something that can't wait, 911 or the ER, those are always, important options to have handy. If you think your kiddo might be suicidal, you think they might be thinking about taking their life, or they might be thinking about hurting someone else, or they might be really out of touch with reality and very ill in that moment, then the ER or calling 911 to get help to get to the ER would probably be your best bet. Our emergency room does have psychiatrists who are on call who can come to evaluate children. So that is definitely an option if it's needed. And if kiddos have to get admitted, right now the Molokini unit does not have the child and adolescent unit open. It is very hard if they've only got 1 or 2 kids in there to keep all the staff required. So I think my understanding is that's been the trouble with having it open. In part is, having it be a therapeutic space for kids. And it can be very overwhelming if you're the one kid there and you've got a whole bunch of staff and they can't really do groups and programming and things like that. So at this point in time, if any of our Keiki are ill enough to need to go to the hospital, oftentimes they will get transferred to Oahu from the ER. I want to also mention 988. I know we might not be able to do a show of hands as easily, but how many of you guys have heard about that? I see some hands going up. Excellent. So yeah, so 988 is now kind of like 911, but for mental health emergencies. So that is nationwide. That's kind of cool that we have that now. And as I understand it, if you're dialing from a local number, it will get you over to people here. So you'll get a local crisis worker, I think through Hawaii Cares, which was formerly called the Crisis Line of Hawaii or Access Line. And you'll see the previous number there, the 800 number. Danielle, do you know if that's still operational?
Yeah, the 800 number will work, 800-753-6879. But we do suggest to basically call 988 because it gets priority going into Hawaii Care system. And then also, Dr. Kawamura, I put in the chat that schools do have access to be able to call directly to 988 and then be able to get crisis mobile outreach to come out.
Yes.
If a youth is or a Keiki is troubled and they need to get to the ER for a psychiatric evaluation.
Yeah. Yeah, no, that is an excellent point to bring up. I've definitely had patients of mine where the crisis mobile outreach worker has given me a heads up. Hey, I came out and I assessed them at the school. So it is wonderful that that is a resource that our community has. And so, yeah, that is a wonderful thing. So, so Hawaii Cares, you know, not only can they help talk through a crisis, like let's say it's 2 in the morning and your kid is having a meltdown and you're not sure what to do, they can talk with people over the phone to help try to diffuse the situation, figure out what's going on and provide support. But as Danielle mentioned, there's also CMOs or crisis mobile outreach workers who can get to the scene and try to help a family that way. And if things are bad enough, they will help the family or the Keiki get to the ER if that's the most appropriate place for them to be. Because yeah, we definitely don't want to lose an opportunity to help someone who really needs that help. There's also the crisis text line. So that's something that's handy if it's not quite like super emergency, but you know, maybe you've got that appointment coming up in 2 weeks, but you're feeling really stressed out. So there's the crisis text line. People can text Aloha to 741-741. So when you look at the keys, it's right up the left side there, 741-741. They tried to make it memorable, easy. And then, you know, because sometimes people are not in a space where they can talk out loud about what's going on, but they need some support. And, you know, especially for teens, they're so, you know, everything is on their phone these days, right? How many teens are walking around like this all the time, right? So sometimes that's something that can be helpful to get more immediate help if they need to kind of cope through a difficult situation, but they're not in a space where they can talk out loud. So let's see, just show here. Ooh, this thing falls.
Amber, may I ask you a question?
Sure.
Hi, so I'm Alex with MEO Head Start. So we work with 3 to 5 year olds, and I'm curious to know, like, for the numbers, the crisis line, or even if families have to call emergency for, like, if a child is having a breakdown, like more severe. What kind of trainings, like especially for the police officers in working with younger Keiki? Because we've heard, you know, some stories, you know, of things that happen, and they may not always have that, you know, the early childhood background in dealing with young Keiki. So I'm curious to know what type of training they receive in working with the younger population.
Yes, I'm not a part of Hawaii Care, so I'm not entirely sure what their training background is. Danielle, do you have any information about some of the training? I know that through the police department, they do have the core program where they do try to help educate certain officers about mental health in general, but it's probably framed more towards adult issues. But yeah, Danielle, any thoughts on that one? Or
you know, I'm not exactly sure, but I'm glad to reach out and see if we could get a more definitive answer.
And I think, you know, if it, yeah, it's hard being in a rural area, right? There's only so many resources. And so sometimes our resources can't always meet every spectrum of where people are on the age range. But at least in terms of the emergency room, there are some of the psychiatrists on call are actually child and adolescent trained. And through child and adolescent psychiatry training, you treat, you know, toddlers to teens, everything. So at least in terms of that part of the resource, the ones that are child and adolescent trained certainly could see a 3-year-old, a 4-year-old, a 5-year-old and assess.
Thank you. I was curious because you know, we only receive information from our families if they ever had to call and things. So we take their word for it, right? We're not there when it happens, but sometimes we know that it could be the person's perception of what took place, how they internalize, you know, words that were said, you know, and things like that. So I was just kind of curious and wanting to know more, like if families did call 911, and you know, not a lot of people would believe, like, you call 911 for your 4-year-old, but we've seen some pretty extreme behaviors over the past few years, and some Keiki are bigger at that age. So really, you know, the parents or other people might feel it's a danger, you know, to themselves and others. So they make that call. And sometimes the reports we get back are kind of, you know, surprising about how the interactions that took place and words that were exchanged. But like I said, this is just us receiving that information. So it'd be kind of nice to know more. But thank you for finding out, Danielle.
Yeah, it's always good to ask for a crisis or for a CIT officer, a crisis intervention trained officer whenever you call. They do actually have quite a few officers, about 1/3 to maybe like 40% now of the Maui Police Department trained. And it is intensive 40 hours. They do touch on children's mental health, I know, during that time. And, you know, so they're always good to have because they'll have access to be able to call for a CMO to help come to the scene as well, and then get them to, you know, get an evaluation. I do know that there are CIT officers in Hana, and there's also CIT officers in Lanai as well as Molokai. There's going to be more because the chief is mandating that all police officers during the course of the next few years take CIT. So that's a good thing.
Definitely.
That's definitely really good. Thank you.
Yeah, no, it's awesome. I think, you know, the more that stigma is breaking down and the more that people have these kind of conversations and the more that mental health is prioritized, these kinds of things start to come into our communities. You know, we start to see these kind of changes where, oh yeah, mental health is pretty darn important. So we all need to know about it. So it is lovely to see those changes happening. All right, any more questions? Okay. All right. So, you know, this was more just kind of so your eyeballs see it once. And if you ever want to go back and Google around a bit more, you can. But, you know, if you look at the Hawaii State Department of Education, they do have some stuff about mental health on their website. So it is a priority of theirs. And like I mentioned, they do have school-based behavioral health specialists. They're different than just like a grade level counselor. So they do have some training and background in mental health and can help provide counseling to students. They can help provide supports to the teachers to try to help understand, right? Because the teachers are, you know, educators. That's their primary thing that they trained for and that they love and they want to do. But mental health is really important, right? There's a ton of kids who are running around who may be having some mental health struggles who will need support. And so it's nice that the schools have the school-based behavioral health specialists to help support the teachers and help them understand what might be going on with one of their students that's leading to some behavioral issues. Let's see. There's also, I just want to mention, you know, going back to the Facts for Families on the ACAP website, there is a really great one about school services and knowing your rights. So this one's a little bit lengthier. I think this one's like 4 pages long, but this one, it does go over the different laws related to supports for kids who have different abilities in school and whether those abilities are related to mental health or physical health. All of our kids, you know, deserve to have their free and appropriate public education in the least restrictive environment. So it can be handy to have some information on that. So that's a good one if you're ever trying to get some services for your kiddo at school. And then let's see, oh, come on, cursor. Okay, and then Child Adolescent Mental Health Division, CAMD, they also have a website and they've got some cool resources on there. I think they're doing some free groups and different things too. So that might be a cool resource to check out as well. You can see they've got stuff on the Maui Family Guidance Centers down there. And so again, different places to get help. Hawaii Cares has a website, so you can check that out too. And I was kind of, you know, Googling around looking for some of this stuff. And I was like, oh, wow, you can call, but you can also text and chat to 988. Who knew? Like I knew about the crisis text line, but apparently 988, you can text as well. So, but yeah, another cool resource we have. And then the crisis text line, if you Google around about them, you'll be able to find their information too, right? So you can text Aloha to 741-741. And they'll have a trained crisis counselor who will respond usually in 85% of cases in under 5 minutes. So fairly quickly. That's a lot quicker than, you can wait two weeks or 2 months for an appointment. So sometimes it's nice to be able to get some advice and support, before that. Okay, so that's kind of a lot of stuff, right? So, we might be thinking, oh my gosh, how am I going to cope with all that? Like, if you're dealing with a kiddo who unfortunately is struggling with mental health issues and it's really showing their behavior, they're having these big meltdowns, that can be difficult coping, especially if it's something that's happening frequently. So in talking about coping, there's coping for us grown-ups, for parents, for educators, for the people around our Keiki, and then there's ways that our kids can cope. So I kind of first wanted to talk about, like, how about us grown-ups? What do we do for support? Well, like we talked about earlier, asking for help is a sign of strength, not weakness. So sometimes it can be really helpful to talk with family and friends about what's going on. I've had a lot of patients over the years who, they didn't really talk about mental health very much. And then as soon as something was going on or got diagnosed for them or someone in their family, they started talking with other people and they're like, oh, wait, you guys have stuff too? And they realize, oh my gosh, I'm not alone. And it can be very helpful. It can be a relief. It can be a great support to be able to talk with someone you already trust and be able to share on a different level and get that support. Not everybody is always as lucky to have family and friends who can provide that kind of support. So it is, also nice to have different resources in our community for support and education. So things like Mental Health America, who's putting on this brown bag lunch today, right? Or NAMI, the National Alliance on Mental Illness. And I'll show you some of their websites later too. But these are organizations that, really want to promote awareness about mental health and decrease stigma and help people get support. The last bullet here too, though, I'll mention. So, there have been a lot of times where I'm assessing a kid and the parents going, oh my gosh, that sounds a lot like me. So oftentimes it's like, well, hey, maybe it might be helpful for you to get an assessment, because sometimes people have been, cruising through life and they've had ups and downs, and maybe they've had something going on mental health wise that they never knew was something that could be diagnosed or treated. But gosh, it might make a world of difference, So always can be handy to get an assessment oneself, right? To find out what might be going on. Or that, maybe you're having a kiddo who's struggling significantly and you're kind of feeling burnt out. So sometimes therapy can be really helpful if you're dealing with caregiver burnout, right? Just like people who are, caring for an adult with dementia, there could be a lot of caregiver burnout, but the same thing can happen if we're caring for a kiddo who has a lot of difficulty going on. So, so always nice to, get help for ourselves too. And the other thing that does is also set a great example for the next generation, right? So if we as adults are showing that, hey, it's totally cool to say, I'm struggling and I need help and I want to go to a professional and I need to get help and I deserve help. I deserve to feel better and I deserve to be supported. And we're showing that to the next generation, that they deserve help and they deserve to be supported, and that it's okay to go get this organ checked out, just like it's okay to get your heart or your lungs or any other part of your body checked out if it's not feeling well. So, so yeah, important for us to cope, and in coping well, we model that for our kids, for our Keiki. Okay. See if I can get to the next slide. So I want to give just a few stats, right? Because it's like, me, why do I have to get assessed? Well, actually, like 1 in 5 adults experience mental illness each year, and less than half are getting treatment. So, when you think about it, that's a lot of people, right? If you go to the mall and you count 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, 1, 2, it's a lot of people. And unfortunately, mental health doesn't always get as much promotion or awareness as other kinds of health conditions, right? There's cancer walks and there's walks for the Heart Association. There are actually also, though, walks for mental health, maybe not as many, but there's going to be in September, hopefully. We'll have the date isn't finalized yet, but the Out of the Darkness walk to promote suicide prevention and awareness. So again, it's kind of the culture is changing around mental health, and that there can be more awareness and less stigma. So, so it is important for us to be aware of that. And it's great that there are opportunities for more awareness for everybody in the community. Let's see, 1 in 6 youth experience a mental health condition each year, and only about half get treatment. So, even though that's a lot of kids, not all of them are getting the help they need. This is kind of really a bummer. The average delay between the onset of mental illness symptoms and treatment is 11 years. So there's a ton of grownups over there, out there that don't get help for a long time. But can you imagine if you're a kiddo and you've been struggling that long? That's a lot of important developmental time that's missed. So that's why early intervention is really key. Getting that assessment early can be extremely helpful. And then the last part there, 65% of Americans are concerned about the stigma around mental illness. So I'm hoping that that's changing. I think it's, as horrendous as COVID has been, some of the silver linings of it are that people have been more aware about mental health and addiction issues, because that's definitely been on the rise with everything that we've all been through with this pandemic. So I'm hoping that, as the years go on, that number is going to go down. And especially with the work of groups like Mental Health America. So Mental Health America, hey, no shame, get help, right? So they've got a lot of wonderful resources. You can see there, they've got the Kokua Life app, they've got suicide awareness mini conferences. So Mental Health America is really a tremendous resource for our community. They do a ton of advocacy trainings. So it's really a blessing for our community to have Mental Health America. NAMI, National Alliance on Mental Illness. They also have some great resources and support groups and things. So another wonderful resource. And thank you, Danielle, for putting those websites in the chat. Greatly appreciate that. So I want to switch. I want to take the last couple of minutes to talk a little bit about coping for kids. And hint, hint, sometimes grownups can use these things too, and they can be really handy. So, you might be like teaching it to the kids, but boy, are they handy for ourselves sometimes, especially if our kids are acting out. So I'll spend a few minutes on that, and then we'll open it up for questions. So, kind of like we were talking about before, what we're doing is kind of modeling for our kids what they could do. So in us being able to talk about our feelings and how we cope without oversharing, but for us to be able to do that, models to our kids that it's okay. We can talk about feelings. They don't have to be these, scary things that we keep buried in us or stay quiet about. And we can ask our kids, especially when they're teenagers, right? It's easier when we can talk together as a team, right? Hey, what helps you? What helps you cope? What helps you calm down? Because if they're getting more upset, we don't want to be doing the opposite things that are going to make them more upset, right? If we kind of have an idea of like, oh, yeah, I remember you told me that, if I give you some time to chill in your room, that will help you calm down faster. Or if I say this and that, it can be nice to be able to have that kind of dialogue so that we're helping our kids cool down easier instead of ramping them up. Some people will make little coping cards, like especially with younger kids, it might be handy to put like, oh, we're going to put this coping skill on a card and this one, and then we'll have them on a little ring, and kids can look through and say, I want to use this one. Some people put lists on the wall. And then we can talk about some different skills. So, part of it is being able to identify your feelings. So again, like some kids, sometimes even teenagers, don't have a lot of awareness to describe quite how they're feeling, especially if it's not something that's really talked about in their families. So sometimes, things like this can help, like, okay, especially with the younger kids. So, okay, this is what a feeling would be, right? Like, okay, this is what angry looks like, or this is what worried might feel like, and for us to kind of give them that vocabulary about their emotions can be really helpful, so they can help us understand how they're feeling. I'll show you on the next slide. There's a cool website that has these different conversation cards so that you can talk about mental health at home, because some of us didn't grow up in families where we talked about mental health very much. So we may not have grown up with much vocabulary for it. So it might feel like, oh gosh, how do I talk about my kid and this stuff with my kids? So you can check out onoursleeves.org. It's kind of a cool website. They have, I think you can order those discussion cards, and they have other things like, hey, let's not use stigmatizing language that labels people. Let's instead use people first language that shows acceptance, cool things like that, where we're trying to turn things around and not make mental health stuff sound like a bad label, right? These are just health conditions like any other condition, and they deserve to have support and treatment. Let's see. So we're going to talk about a few coping skills, and we'll wrap up for some Q&A. So I wanted to talk a little bit about deep abdominal breathing, progressive muscle relaxation, which is otherwise known as robot ragdoll, guided imagery, and then a grounding exercise with 5, 4, 3, 2, 1. So deep abdominal breathing, sometimes in kids, we kind of do like in the picture where you either have a hand on your chest and on your stomach, or you can like put something on your tummy. And the idea is that when we're doing deep breathing, you want to breathe in through the nose and out through the mouth, but you really want to be breathing in so deeply that you're pushing your diaphragm down. And so the belly kind of goes up instead of doing chest breathing, right? We don't want to be breathing shallowly and hyperventilating and going, right? So we don't want this hand moving. We want the bottom hand moving. So kind of doing that belly breathing is sometimes what we call it for kids, right? So taking that deep breath in and slowly out. Sometimes kids like to use a little bit of imagery, right? You might be breathing in a certain calming color and blowing out that angry color. And so this is something, I'll say all of these skills are really more helpful if they've been practiced before you have to use them. So it's best to kind of work on things like this. And these are the kinds of things that a therapist would often teach families and kids so that they can cope, because you don't want to be trying to use it for the first time during a meltdown. Like, okay, like slow down and put your hands here, and they're in the middle of a meltdown. You want to practice this ahead of time so that when they're in it, you can remind them like, hey, remember this was one of your coping skills, or this was on your coping card. Let's try it. So deep abdominal breathing can be a nice one to really calm down. Some people will call it box breathing too, you know, breathe in, hold, breathe out, hold. So there's different ways of doing it, but the idea is that you're really slowing down your breathing, getting that oxygen up to the brain and helping the body to calm down, helping that heart to calm down. There's progressive muscle relaxation. For grown-ups, we do this at kind of a longer version, where as you take that deep breath in, you're tensing a muscle group. And then as you breathe out, you're relaxing that muscle group, and you pretty much go through your whole body, which can take a while. But for kids, we'll make it a lot simpler. So robot ragdoll, right? Robots are tense and ragdolls are floppy. So with younger kids, we might just do our whole body instead of one muscle group at a time, right? So breathe in and get tense like a robot, tight as you can. And when you breathe out, some people will also use the analogy of a dry spaghetti noodle and a wet, floppy cooked spaghetti noodle. So, okay, we're going to breathe in and get tight like that dry spaghetti noodle. And now we're going to get all floppy like that wet spaghetti noodle. So you can kind of have fun with it with kids. But yeah, it's just kind of helps get another focal point, right? If we're getting all worked up, we might be kind of tense and not even realize it. And this kind of helps us to focus on that and really let it go, let that body tension go. So this can be kind of a fun one. There's also guided imagery. So I don't know where you all are sitting right now. You might be in an office, you might be at home, you might be somewhere, but you might not be feeling super relaxed. You might be like, okay, I got to do this, and I got to scarf my lunch, and then I got to get to the next thing at 1 o'clock. So you might not be feeling that relaxed, but if you wanted to, you could do some guided imagery, right? We could be like this person and thinking, oh gosh, I wish I were on the beach. Oh yeah, I can really imagine. What would it be like there? Smelling that salt. Oh, I'm hearing the waves crash. Oh, what a relaxing sound. I'm feeling that sunlight on me. Oh, it's warming me up. Oh, maybe I'm tasting that delicious drink in my hand. Maybe it's something lilikoi flavored. Oh, so kind of the idea with guided imagery is you're taking yourself somewhere else and you're using all your senses to really feel that you're there. And that's something with kids, you can tell them like, hey, we're going to have this, we're going to imagine this safe space, your special space, right? And that's where you can just feel nice and relaxed. And again, if you practice that ahead of time, it's a lot easier for kids to get there when they're feeling stressed out or something bad is happening, right? If they practice going to their special place like 20 times already, they can get there a lot more easily. But the trick is really imagining it with all your senses. Or sometimes with kids, we'll think of like, what's a really positive memory? And let's imagine all your senses there and imagine that, and that's your place. And so that can be really helpful for them to calm down. So again, kind of using all your different senses, right? What do I see? I see the beautiful scenery at the, the ocean, the trees, the birds. What do I hear? I hear the waves crashing. What do I smell? That saltiness. What am I touching? I feel the heat on me, the sand in my feet and my toes, and maybe I'm tasting that saltiness, or I'm tasting something I brought with me. And then that also kind of leads into the 5, 4, 3, 2, 1 grounding exercise. So you can think, okay, so this is something that helps to kind of distract people, whether they're little kids or big kids like us grown-ups. Sometimes we need to relax too. But the 5, 4, 3, 2, 1, you would think, okay, what are 5 things I can see? Okay, I can see my TV because I'm sitting in my living room. I can see cute pictures of my kids. I can see some board games we have. I can see this computer. I can see you guys, right? Okay, let me think. What are 4 things I can feel? Okay, I feel the couch beneath me. I can feel that my fingertips are a little chilly because there's a cool breeze running through my house, right? That's 2. I can feel the feeling of my clothing on me. I feel my glasses on me. Right. So I'm taking some time. I have to think, right? So if I'm really upset, I'm having to refocus on something else. And it's hard for me to keep thinking what I'm upset about because I'm trying to think through my senses and make sure, okay, I got 5 for the first one. I got 4 for the next one. Okay, what's the next one? Okay, what are 3 things I can hear? And then you go through, right? Usually the ones that are easier, like seeing, feeling, and hearing, are the ones that you want to do 5, 4, and 3. And then 2 and 1, maybe, 2 things you can smell, 1 thing you can taste. Maybe I taste what I ate for lunch, But that, again, it kind of helps to distract you, get your brain in a different space than being all upset and worked up. So that can be a good one to help people to kind of calm down and get grounded again. So, all right. Well, I want to say mahalo nui loa for sharing this time with us today. And again, happy Mental Health Awareness Month and happy Keiki Mental Health Awareness Week. And again, thank you all for being here. And I'm happy to answer any questions you may have.
Thank you, Dr. Kawamura. Really appreciate this. And I do love how you get animated when you're doing your presentation. I do want to remind everybody that we do surveys just to help us, better get these, these brown bag lunches to you. So this is still our 2022 version. So if you click on that and just open up another link in your browser, you can actually do that when we're done. And I did put our website in there earlier, and I want to make sure that you have our help page, which I try to locate it to, but specifically, this is our Finding Help resource guide. This is a very comprehensive guide to resources across the state. And then also our national website, if you're ever thinking about whether yourself or you're a Keiki, might want to get a little more information, you can do a free mental health screening. There's actually a youth test that's there as well. And, there's no diagnosing or whatever. We give you feedback and possible information on next steps to maybe take, like talking to your pediatrician, if it was a youth test or things of that nature. So those are our couple resources, but please, anyone who'd like to unmute or pop something in the chat, we still have 6 or 7 minutes for questions. So please go ahead.
And thank you for mentioning the screenings. I meant to mention it and totally forgot. So that's a pretty awesome thing that Mental Health America has.
Thank you.
Is everybody still imagining the beach or wherever else we'd rather be?
I use guided imagery a lot when I'm having a stressful day. I do.
Yeah, it's a good one.
I just Google it. I Google it and take my my lunch period, and I'll just take part of it and just listen to it. It's wonderful.
Lovely. Yeah. That's the cool thing. There's a lot more apps these days and just different resources. You can find stuff on YouTube. So there's ones that are more guided where someone's actually walking you through it. And so, yeah, it's wonderful that there's so much more out there compared to when I was training or when I was a kid.
So Natalia says, thank you for all you do, Dr. Kawamura, and sharing this information today. Paige says, thank you so much, Paige from the Spirit Horse Ranch. Healing Hearts and Equine Therapy. That's a new nonprofit that's is just started here on Maui. They're wonderful. We actually did a youth mental health first aid training for their entire staff just about a month ago. It's a great place for the information to jumping off point. Thank you from Gail. Amanda says thank you. Madeline, thank you for making this information so accessible in terms and descriptions that you used. Good feedback. Thank you, everybody. Any questions? No need to be shy, right? Questions are how we learn. Tanya says mahalo for the resources and guidance.
Not a question, but just a comment. Amber, I wanted to share for anybody who works like closely with the younger Keiki. When you talked about grounding, there is a local book called Kona the Crab, and it also talks about trauma-informed practices because it's a nice way for Keiki to relate. This little crab got caught in a like a hurricane, like tsunami kind, and he was traumatized by it, so he was always scared, but his mom, a crab, was able to help him through it by helping him stay grounded with the 5, 4, 3, 2, 1 technique.
Oh, cool.
And we've actually seen it really help like some of our more aggressive children when they're going through stuff and need to calm down. So one little boy that we would work closely with him, he actually started to use it on himself and start doing it. And then he would like tell his friends and then his mom. There was a lot of domestic violence in the family. So we could kind of see, where this was stemming from. And so I thought about that because I just think it's fabulous. And then we do a lot of children's literacy to help with trauma-informed practices, but also, helping children cope through that kind of things.
Yeah. Yeah. I think when it's more, when there's kind of that cultural component, it can resonate more with people. I think there's also kind of a local version of like Appropriate Touch book. I can't remember the name of it, but I have it in my office. But yeah, it's really nice when it's geared towards the little kids, because sometimes there aren't as many resources as for older kids or people with a higher literacy level. So it's wonderful that there are things like that. Do you mind sharing the title of that again?
Yeah, I'll type it in the chat.
Wonderful. Kona the Crab. Cool. Yeah, definitely.
We're really big on literacy here. And then we always try to find those types of books because it's something our Keiki can relate to. But then what we do is we have a lending library, then the Keiki can take it home and then read it with their families.
Yep, and then ripple effects. Yeah, a lot of times the trauma is, multi-generational, and people are doing the best they can. And if that's what they grew up in, they're doing what they know. And I think that's why the part about us seeking help and us trying to model for the next generation, maybe the generation before couldn't model that for us because of what they went through. But at some point, if whoever can help to, break the cycle, it's really a beautiful thing when that can happen. And sometimes that comes from the outside. So that's amazing that you guys are doing that.
Thank you.
Anybody else? Okay. Well, thank you so much, Dr. Kawamura. We really appreciate you. There was great feedback on this training. You're so helpful. I'm so happy that you're on our advisory board and always willing to give back. We definitely appreciate you a lot. Thank you all for coming today. As I said earlier, we did do a video of this today, a recording, and we also have the PDF. So we'll be posting the recording on our YouTube page, and I will send you a PDF, and I'll send you the most recent crisis resources for the state of Hawaii, which includes adult and youth resources. So with that, it is exactly 1 o'clock, and I hope all of you have a wonderful rest of your Monday. Thank you, Carter, for coming. And always remember that asking for help is a sign of strength and not weakness. And do something nice for yourself today because you deserve it. Thank you.
Mahalo, everyone. Mahalo, Danielle.